Yes, thank you so much for allowing me to participate in this virtual interview with NeuroNews. My name is Sudhakar Satti. I am a neurointerventional radiologist. I practice in the United States in Delaware. I have been in practice since 2007, and I first used the n-BCA TRUFILL system in 2002. So I have over 20 years of experience using the product. I have been very fortunate to have been trained on n-BCA, and during the course of my training, second agent was commercially available in the United States, Onyx, another liquid embolic agent. So I feel very fortunate to have been able to train on both systems, and it allows me to choose the product that I think is best for the individual patient. One of the main things I like about the n-BCA liquid embolic system is the ability to tailor the product to the anatomy, the pathology, and the physiology of the patient and the pathology at hand. So I'm able to change the polymerization rate. I'm able to change the timing of polymerization. I'm able to change the viscosity. And I have a variety of different techniques and tools that I can use to change them. When I first trained on the system, I will be honest and admit it was extremely stressful as a resident and fellow in these cases. And the constant fear that we had was that there would be catheter entrapment and that there would be reflux of liquid embolic material. And over the last 20 years, the system hasn't changed, but what has changed is our access tools, the microcatheter system, the navigability of the microcatheters and wires, and the imaging quality have significantly improved. And one of the main concerns that we used to have is catheter entrapment, and that is virtually completely eliminated. In the last 20 years, I have never glued a catheter into a patient using the n-BCA system. And the main change is using braid reinforced microcatheters. So when we trained on the system 20 plus years ago, we used to use flow directed microcatheters. And those catheters, if there is substantial reflux, they're much higher likelihood of being entrapped. So we've switched, unless there's a specific need to a very, very distal, hard to catheterize lesion, to braid reinforced microcatheter access over a microwire rather than using flow-directed microcatheters. Number two, we don't really want to see reflux past the tip of the microcatheter. And so with the improved imaging, we're able to detect any amount of reflux, a millimeter or two. I would feel comfortable with 5 millimeters to a centimeter of reflux in a straight segment, and we rarely get more than 1 or 2 millimeters. So definitely catheter technology. There has been significant improvement in imaging. So those are two of the main things that have improved. So we've had the n-BCA TRUFILL kit in our hospital for over 15 years. And when the new procedural kit was available, I was pretty excited about it. The reason I was excited is when we have these n-BCA cases, before we were opening the n-BCA product, the TRUFILL kit, but then we were opening probably between 10 and 15 other small products, including syringes, needles, different size syringes, and there was always a little bit of stress from the staff regarding what we should open, and then there was always a little bit of a time delay. So if I was in a critical portion of a procedure, I found it very distracting to oversee the kit being open and the appropriate products being dropped onto a sterile separate field. And when we moved to the procedural kit, we had identified significant advantages in the speed of preparation, the efficiency for both the staff and the physician of preparing the product, significant improved efficiency in terms of inventory management, because instead of now making sure we have maybe 10 different products on the shelf, albeit some of them were very small and inexpensive, it just became more complicated to prepare a case. And then finally, we felt like there was going to be a clinical benefit and patient benefit because of the efficiency and comfort with both the physician and the staff. Having the procedural kit as a alternative to the TRUFILL kit, we've seen significant benefits at our main hospital in terms of staff comfort, in terms of inventory management, and in terms of speed of preparing the product for injection. One thing I did not really appreciate is how helpful the procedural kit would be at a lower volume center. So about 2 weeks ago, I had a very complicated pediatric case that I had to deal with, and the staff that I work with at the pediatric center does not do the same volume that we do at our adult center. So they have a tremendous amount of stress in terms of preparing the neurovascular tray and also any embolic material. So at that hospital, we took the procedural kit there. All I said is we just need to put it on a sterile table. And there was a tremendous amount of stress reduction in the staff, but I was surprised that I was actually less stressed by having the procedural kit. And the reason I was surprised is I've used TRUFILL for many, many years, and I did not think the procedural set would be an advantage for me because I'm comfortable using the old system. So I would say the procedural kit for experienced users is tremendously helpful in terms of this efficiency and speed and patient safety. But for new users who've never been trained on the system, there's a tremendous benefit because it simplifies the procedure and the prep. It also helps organize all of the materials in a single place. And one of the other advantages of n-BCA is we often use the same kit to treat multiple pedicles. So we're going back to the same tray, and having everything organized and in a very set space is very, very helpful. One of the biggest learning curves was comfort with the staff and the physicians of how to prep the n-BCA, and the procedural kit now removes a lot of that stress. So there's just tremendous clinical benefit. There is a learning curve, which is a lot shorter than it used to be, and the applications continue to expand. And then in summary, I would say this is a critical tool in the armamentarium of every neurointerventionalist.